It's such a different type of tiredness. I couldn't sleep enough to stop the fatigue. I feel like I'm withering away. Just being alive was exhausting. Cancer-related fatigue is defined as a distressing, persistent, and subjective sense of physical, emotional, and/or cognitive exhaustion that is directly related to cancer and/or its treatment. This fatigue is not related to recent activity and has profound impacts on usual functioning. Fatigue is one of the most common symptoms for people with brain tumour, with about 39% of people with low-grade gliomas reporting fatigue for up to 8 years post-treatment, and approximately 94% of people with high-grade gliomas also reporting fatigue. Despite this, most prior research has focused on quantitative assessments of fatigue, thus failing to capture the rich, nuanced insight that can be offered through patients' lived experiences. So, as part of the MRFF-funded BRAINS program, we aimed to address this gap by qualitatively exploring fatigue among people with brain tumour. To do this, we conducted semi-structured interviews with people with brain tumour, caregivers of people with brain tumour, and healthcare professionals with an experience caring for people with brain tumour. And we recruited these 3 different participant groups to gain a holistic understanding of the fatigue experience. We then conducted Zoom interviews which explored the experience, impact, and management of fatigue, as well as the type of support offered by healthcare professionals. And then we conducted a thematic analysis using a framework approach. So we had a total of 40 participants in this study, and there were 24 people with brain tumours, 5 caregivers, and 11 healthcare professionals. Among the people with brain tumour, they were mostly gliomas, with a roughly even number of low versus high-grade gliomas and a roughly even number of male and females. Among our caregivers, they were all female and caring for a spouse. And among our healthcare professionals, there was a range in clinical specialty and years of experience. However, for most, GBM was the most common type of tumour seen in clinic. Now, our qualitative analysis identified 4 themes. So we had the pervasiveness of fatigue, the impact of fatigue, advice and support offered by healthcare professionals, and then finally, fatigue self-management strategies. So we'll start off with the pervasiveness of fatigue. All participants said that fatigue was a common symptom for people with brain tumour, so it was that universal idea. Treatment, medication changes, and disease progression contributed to variations both within and between participants. However, for most, fatigue was described as a pervasive side effect that persisted long after the completion of treatment. Aligning with conceptual definitions of fatigue, there were physical, emotional, and cognitive aspects to it. So for the physical side of things, it was described as that exhaustion that was unalleviated by sleep. For the emotional side of things, it was that idea of being overwhelmed, irritated, or emotional. And then finally, for the cognitive side of things, it was the idea of that clouded, foggy mind, which included memory, concentration, and language issues, and being easily overstimulated. So obviously, this had an impact on a range of different aspects of the patient and caregiver's lives. So starting off with the idea of worsened brain tumour symptoms. So for some, fatigue exacerbated pre-existing brain tumour symptoms. And this included increased seizure risk, cognitive issues, and neurological deficits. So things like vestibular issues and hemispatial neglect. There were also psychosocial impacts, so impacts on relationships and mental well-being. And this included low motivation, depressive symptoms, and reduced self-confidence. Normal social interactions and group gatherings were described as tiring and effortful, and this had an impact on personal relationships and home life. And then fatigue-related emotional regulation issues like irritability led to relational tension, which only had further detriment to the participants' relationships and home life. And then finally, we had functional impacts. So most people with brain tumour reported having to reduce or entirely stop their work or study. Everyday tasks like groceries, showering, cooking, and cleaning were described as tiresome and effortful. And then the patient's constant need for sleep, neurological deficits, and reduced motivation limited their ability to engage in meaningful and fulfilling activities like hobbies and travel. And I will note that all of these impacts had further impact on the caregivers as it increased that caregiver burden, which only led to their own fatigue, functional and psychosocial impacts. So moving on to the support and advice that was offered for fatigue. So almost all healthcare professionals in this study reported that they routinely assessed fatigue through informal inquiry. So things like conversation, asking, how are you, how are the energy levels, what's your fatigue like? And they typically recommended pharmacological, so things like adjusting medications, adjusting steroid dosage, and or non-pharmacological management, so increasing physical activity, improving your diet, things like that. In contrast, patients and caregivers reported that fatigue assessment, advice and support was rarely provided by their healthcare professionals. And among those who did receive advice and support, the actual effectiveness or helpfulness of this support varied among participants. So there was a bit of inconsistency among our participant groups. However, across the board, our participants identified a lack of specific fatigue resources and interventions designed to support people with brain tumour through their fatigue. So because of this perceived lack of support, people with brain tumour and their caregivers felt that need to manage their own fatigue, and mainly through trial and error. And there were three main categories that they did this with. So to begin with, we had lifestyle changes. So this included increasing physical activity, eating healthy, monitoring caffeine levels, improving sleep hygiene. Then there was the idea of accepting their new normal. So some participants said that accepting their limitations, having self-compassion and listening to their body was key in managing their fatigue. And this enabled them to plan their activities in advance with their capabilities in mind, and then dedicate what limited energy they had to the tasks that they really wanted to do. And then finally, we had support seeking. So this included communicating needs, setting expectations at social events like I'm going to be leaving at 8 p.m, requesting referrals to allied health professionals, and researching information on their disease, causes of their fatigue, and potential strategies that they could try to help manage it. So in conclusion, our study highlights that cancer-related fatigue is a pervasive symptom for people with brain tumour, and has major impacts on the quality of life for both them and their caregivers. Despite this, there is a reported lack of advice and support provided for people affected by brain tumour in how to manage their fatigue, and there is also a lack of information, resources and interventions designed to alleviate their fatigue. So overall, we urgently need to develop clear clinical pathways to identify and manage cancer-related fatigue for people with brain tumour. Thank you.